Hey there, this is Dr. Roger Mochigimba at Direct Med Clinic. I wanted to talk a little bit today about Molnupiravir, the new Merck drug that has come out for early treatment of COVID-19. Molnupiravir has been around for a few years. It was developed as early treatment for the flu, and it's been in trials for that. So then when the pandemic happened, they took another look at its use for possible treatment of COVID 19, early treatment for COVID 19. So I like the idea that now there's more talk about early treatment because previously that wasn't talked about much, although it is so important because the nature of COVID 19 infection is there's this viral phase, which is about the first 10 days, and then after that, the virus is done replicating itself in the body, but our bodies are reacting to the, the viral debris, and our immune system is kind of overreacting to it, and that's what gets a lot of people in the hospital and gets them in trouble. So early treatment is really key to keep everybody from getting to that stage. So molnupiravir, how does it work? Well, it is a medication that interferes with viral replication inside the cell. So when the virus gets in the cell and it gets the cell to start making copies of the virus, it interferes with that. The virus is made of genetic material, nucleic acids. So molnupiravir gets it to use nucleic acids that are not quite the right ones. They're a little bit different. So the cell will go ahead and build it that way, but it's faulty and it's going to fall apart. So the virus is kind of like a shell, or it's not going to last. I think of it kind of like if you built a house with rotten wood. You might get it to look okay for a little bit, but it's not going to function. It's going to fall apart. So that's what molnupiravir does. That's how it works. And that is not how ivermectin works. So if you hear that in the media, it's not quite true. So is molnupiravir as effective at preventing COVID and treating COVID as is ivermectin? The studies on molnupiravir show that it can prevent, like, it can decrease hospitalizations and death by about 50%. So that's good. Hopefully that will save lives. Ivermectin has studies that show 75 to 80% reduction in hospitalizations and death. Now let me just talk about the safety of these two drugs. Due to the nature of molnupiravir, it affects the way all cells create these other copies of genetic code and proteins. The virus is made of a genetic code, and on that code, it tells the cell what to do, and so the genetic code obviously is in all of our cells, and it tells our cells how to make bones, how to make proteins, how to make everything. So molnupiravir will interfere with the way that our cells function normally. So there's a very narrow therapeutic range. In other words, if we give a little bit too much of the molnupiravir, then it's going to be very cytotoxic to all of the cells in our body, not just the ones that are infected with COVID-19. So compare that with the safety of ivermectin, which we know that it's so safe it could be used by women who are breastfeeding. It's so safe it's been used millions and millions of times around the world for the last 40 years, and all those other good things that it does. It doesn't have a narrow therapeutic range. In fact, I know of an anecdote with a patient who accidentally took a large dose, very large dose of ivermectin all at once, and he did really fine. He was given that ivermectin for treatment of COVID. His COVID symptoms just went away for days, and he had no ill effects from the ivermectin. So I hope that this little talk has helped you understand a little bit more about Molnupiravir, how it works. I just want to re-emphasize the importance of early treatment, and I hope that if anybody listening to this themselves or has a loved one that does get COVID, to seek the attention of their doctor, and hopefully they can get early treatment. So this is Dr. Roger Mochigimba at Direct Med Clinic.